So, as we're pulling up my deck, I want to pick up and start commenting on a couple of the things that Evan has said. And one of the things, what really struck me, Evan, when you were talking was the slide, all those stats and everything that was floating around. All those stats that came up and the slide about alcohol-related deaths. But what really struck me was the APTN reporters, for those of you who don't know, Aboriginal People's Television Network is APTN, who said, we really don't want to be talking to you. I understand why they had a reluctance. One of the reasons I got into media was to fight stereotypes. But one of the reasons I got into media also was to tell truth. Debwewen, in my language, in Anishinaabe. Drunken Indian is one of the more pervasive stereotypes that we have to put up with. When the Royal Commission on Aboriginal Peoples looked into the drunken Indian, they determined that it had no basis in reality. RCAP examined several studies that showed abstinence is twice as frequent amongst Indians as it is amongst the non-Aboriginal community. Heavy drinking is more prevalent amongst Aboriginal people than it is in the mainstream, but the proportion of people who drink on a daily basis is 7 times higher amongst non-Aboriginal people than it is amongst Aboriginal people. The widely held belief that most Aboriginal people consume excessive amounts of alcohol on a regular basis appears to be incorrect, concluded RCAP. And I concur with that. But in all our efforts to defeat this really pervasive stereotype, the drunken Indian, the elephant in the room when we talk about Aboriginal health is often substance abuse. And many of our people are abstinent, there's no question, but a great many of our people are in pain. And they turn to drugs and alcohol to mask it, or to mask the crisis that they're in at this particular moment in their lives. Or they turn to anything else that they can get their hands on, it's gas sniffing or methadone or Tylenol 3s. And so I do think that communities need to be upfront and open about the scale of substance abuse in our communities and its impact on our health. So sometimes it takes something jarring to remind us of that. I'm speaking to the Aboriginal people here in the audience. I want to show you a condensed version of a story that I did in a tiny hamlet in the north called Kugluktuk. And I got this lovely invitation from kids in the school, and they said, we're putting on a play. Come and watch our play. Come and do a story on our play. And it turned out that the play was about the need to ban alcohol in their community. Now, Kugluktuk is really, really far away from Toronto, but I think it has some lessons to all of us who are providing health care. So I want to watch this short video, and then I'll offer a little bit of commentary about it afterwards. If we can get the next video up. And as we're waiting, Eric's working on it. Oh, there we go. So the play is about a plebiscite that they want to have to ban alcohol in the community of Kugluktuk. But there's no audio. I can narrate it. Can we start it again? Uh-oh. So they're at a dance. That's an ATV. No go? No audio, okay. What the kids told me was that about their lives when they go home and when their parents are drinking all weekend. And there was one really memorable quote that I wanted to show you in particular. It was one young man, he said, it's like it's in their blood. It's like alcohol is in their blood. And he said, kids come first, not alcohol. And that was coming from a 12-year-old. And I think it's important for us as Aboriginal adults to hear the voices of those children, whether you're in Kugluktuk or whether you're in Toronto. And they did have a plebiscite to ban alcohol, and for a short period of time things got a little bit better in Kugluktuk, but it wasn't a silver bullet. So I think it's important for our Aboriginal community to acknowledge truth, Dibwewan, about some of the things that are going on in our communities. I also think that it's important for the health community to understand the complexities of substance abuse. Remember that old man at the TRC who was talking about his memories and said, "I just go and get drunk." And I think we have to understand the complexities of substance abuse in our communities, Aboriginal communities, and that can help us focus our policies and our programs and our services in a way that will really promote health amongst Aboriginal communities. If I could go back to the deck. There we are. I've been talking about this journalism program that I run, reporting in Indigenous communities. Every year we focus on a theme, and our first year we focused on health. All my students, I kicked them out. I said, "Go to the res. You'll learn something there." So, and I said, "Come back and tell me about health." And so the stories that they brought back all these stories about health, we call it Shwaeath, which is a terrible, I'm pronouncing it awfully. Shwaeath. Stories of health and healing. And Shwaeath is a Halkomelem word which means to be healthy. And literally it translates good breath from an inside place. That's what being healthy means to the Halkomelem people, the Salish people. If you take a broad look at all the stories that we did, I think you can see a broader narrative about Aboriginal health in Canada, and it's a hopeful one. It's kind of depressing when I was talking about the alcohol, but I think if you look at the broad picture, it's a hopeful one. 2 of my students discovered that there had been a rash of youth suicides amongst the Stala people, and that's Eunice Ned there that you see in the picture. Her son was at risk for suicide after her 15-year-old nephew had recently shot himself. In response, their community started up a suicide response team composed of 13 volunteers. There they are. There's the suicide response team. Team members shared their stories, and they explained to us why non-Aboriginal counselors often don't help when it comes to crisis counseling and suicide in an Aboriginal context. Another slide. There was this story about how a young Squamish ethnobotanist is trying to bring back the chocolate lily, which is a traditional bulb plant, in order to combat diabetes in her community. There was another one. Oh. Come back. Backwards. There was another story about diabetes. This is the Seabird Island Mobile Diabetes Clinic, which travels really vast distances to remote First Nations across southern British Columbia so that patients can manage their disease without having to leave home. And then there was this one, how Aboriginal grandparents are raising their grandchildren, who raise their grandchildren, are learning to care for kids diagnosed with fetal alcohol spectrum disorder at a unique support group for grandparents in Vancouver's downtown east side. 4 First Nations grandparents run by First Nations grandparents. And in all of these stories, I think the common theme is that First Nations are part of the solution. And there's no question, as some of the slides that Evan showed you showed, that we still face ongoing health disparities. The gap is closing slowly, but we still face some huge health disparities. But there's a continued determination to revitalize traditional healing approaches, such as that chocolate lily, and to build community-driven models of health. And I think if you look at all these stories that my students did, it actually tells the story of the state of First Nations governance in this country, and it's a story most Canadians don't know anything about, because there's this really radical transformation going on in Indian country, in First Nations governance. We've gone from the days of the Indian agent to First Nations public service, which is really what Evan's baby is all about. And what I think one of the biggest challenges going forward in Aboriginal health is going to be building First Nations administrative capacity. And that's so boring. That's so not sexy. That bureaucracy, it's just But some of our people actually say that's a white way of thinking, bureaucracy, administrative capacity. But I think that it's the key to running our own health systems and our collective self-sufficiency, and ultimately our happiness and our well-being. And we all have a role to play when it comes to wellness, all of us here. And certainly mea culpa, I think the media need to do a way better job of reporting, telling these kinds of stories. But for you folks here in Toronto who treat Aboriginal patients or who work alongside Aboriginal health workers, I think it starts with self-awareness. And so I want to take you back to that quiz that I started with. Those questions. In the past, Indigenous people were, now they are. 3 characteristics of Aboriginal people. Sometimes I feel blank when assisting Aboriginal people. I told you that was a condensed version. It's much longer, but I want to jump ahead to the last question. If I can. It feels blank to answer these questions. My students' answers when I give them this test is that it feels difficult to answer these questions, thought-provoking to answer these questions, challenging to answer these questions, interesting. And you may feel all or any of those things when you look at those questions. But I think it's a great place to start the conversation about Aboriginal health, and it's a great place to start the conversation about truth and reconciliation and healing. Cheers.